My goal is that Charlin is a place where their mom and dad can be taken care of at any stage in life. When you're talking about hospitality, it's about the intentionality of how do you take care of people. Just being respectful of all different cultures, races, and whatever it may be. It's you're a human being. We're going to take good care of you, and that's good hospitality.
That's Charles Bryce, CEO of Charlin Health Services, a family-owned, faith-based hospice care agency based in Texas. Speaking with Charles was a privilege and really a joy. It was so clear from the conversation that the power and the sanctity of relationships are everything to Charles. Relationships with the patients they serve, with the families of those patients, with the team at Charlin, a team that includes his mother, who founded Charlin 20 years ago, and his wife, who is a nurse and works with him to continue to run the company today. It's also clear that Charles remains committed to and connected with the mission that animates Charlin. Really, a mission that is about serving others and, believe it or not, bringing joy to what otherwise can be a somber and obviously very stressful period in people's lives. We're doing something different on the Digital Clinic this week. You won't want to miss this episode of the Digital Clinic. Let's sort of start at the beginning. It sounds like you've got a really interesting background, an
Yeah.
interesting history that led you into this business. I'd love to hear about that background and hear about Charlin Health Services.
Yeah, no, it's a crazy background. Yeah, I mean, I grew up in Dallas, Texas, and of an immigrant household. My parents from Nigeria, and everything when I was a kid, they always said, not just them, but just Nigerians in general are huge for like being a doctor or a lawyer, or that's just kind of the big thing. And so, but when I was a kid, I always wanted to be a doctor, just wanted to help people, and so that was like my heart. And so as I got older, my parents actually started a home health company, and my mom's desire for that was to start a home health company where she could basically pass it on to her two boys, myself and my brother. And she's a nurse, and so she saw that at that time the healthcare or company or the healthcare system at that time was transitioning to a lot of private equity, and it was changing the way patients were taken care of. And she was like, I want to start something where I can hand it off to my boys and they could continue to do a good job. And so it started in our literally in our like living room. My mom would go see patients, and then she would come home and chart paper, and I would come 13-year-old shred paper in the living room, eat dinner, and that was just kind of how it kind of started. I never really thought I would be working in the industry as I got older, but yeah, that's literally how it started. And went to school in St. Louis, did physical therapy, played soccer, loved soccer, and found my way coming back here in 2016. And my mom called me. And she was like, "Hey, I'm tired. I need your help." And I was like, "Ooh." Me and my wife, we were like, "I don't know." We prayed about it. We were like, "All right." So I came back, got thrown into it, didn't know anything. My background's physical therapy. Worked at a regional hospital in St. Louis. Enjoyed it, loved it. And so going from bedside to now administration was a big change. And then kind of trying to understand how do you scale in a way that's healthy for patients and healthy for um, you know, the organization.
We also have seen uh, private equity entrance into
Yeah,
hospice
yeah.
services or retirement care. What's the difference in the mission of Charlin Health Services versus larger PE backed hospice services or retirement communities?
Yeah, I think when you look at healthcare as a whole, for us, it's more legacy driven. So we're looking to be a staple in the area for generations to come, God willing, right? So when you're looking at a lot of PE and private back companies, there's always an exit strategy, and rightfully so, right? You're investing $1, you want to get 10 back on that dollar. And so a lot of times when what we've seen in Dallas is that this area is so saturated that the community needs consistency. So what we've done at Charlin is tried to develop the knowledge and the mindset of what private equity does, but at the same time use it in a healthy way for patient care. And so utilizing the same skill sets and the same mentality, but at the same time focusing on how do we focus on taking care of patients and do it for a long time. So I think for me, I've seen it for the last 8 years. Just study the industry, study the market, study different companies, and I'm like, okay, they did that well. Why did they not do well? Oh, because they sold, and when they sold, a whole new change in culture came, a whole new change in administration came. The patients got taken advantage as if they're like just a number and not really a patient. And so I think with healthcare, like, this is just my opinion, but like when you see like a car dealership or you see a product and services industry that doesn't deal with human beings, it's kind of difficult because it's these are people that we're talking about, and especially with home health and hospice, they're vulnerable states, so it's very hard to kind of get your ROI on a human being, and so we try to take that and figure out how do we take care of patients for a long time.
Can you give us a sense of scale?
Mm,
Uh, what are the operations of Charlin Health Services? How many facilities? What sort of patients do you look after?
yeah.
Give us an operational sense.
Yeah. So we serve every year in the Dallas Metroplex, right around 600 patients. So that varies between home health to hospice to veteran services. We have about 55 W-2 employees, and then we do like contract staff, which is contract therapists, contract occupational therapists, contract doctors, and nurse practitioners. So, we're not, the massive companies that you see, but our goal is to slowly and surely over a long period of time grow and help those providers have good stability. So yeah, we service about 600 a year. From that aspect, we just create those relationships with doctors and grow from there. Come alongside them and help them.
Can you describe for anyone listening who may not know what hospice care is, what
Yeah.
home health care is, and in what context you're providing home health care?
Let's break down home health because I feel like it's more easier to talk to when we're talking about home health with families. It's like, oh yeah, home health, let's get better. And so, home health is there's different types of home health, and people see home health as like home care or home health care or homemaker services. But when you're looking at a Medicare certified agency, it's services that are provided in the comfort of a patient's home who has Medicare, right? And so, there's criteria that's needed. So, say for instance, you have a loved one who's weak and has been falling, or who just got out of the hospital who had a heart replacement or a heart valve stent. They need acute care. And so that's where home health comes. And it's usually about anywhere between 60 days to 120 days. And your primary care physician is the one who oversees that and allows for the services, the home health nurse, the PT, the OT, the speech therapist to come in and take care of them. And so, that's where home health comes in. And it's not there forever, but it is there to help. The goal is to help get that loved one back to what they used to do, playing pickleball, like, or just like, doing hanging out with the grandkids. You had a knee replacement. Okay, I'm gonna be down for about 6 to 8 weeks. Home health is there to help build that back up to prevent infection, to prevent hospitalizations and such. So it's a beautiful system. If it's done well, it's a great help for families. And but that's kind of home health in a nutshell.
What's the advantage in that sort of a context of home health care versus needing to go in for an appointment, being seen at a physician's office or at a hospital?
So when you're looking at home health, it's actually a they're they're combined together to be like a help for the family. So when you're going to see your doctor, the doctor only sees you, once every 6 months maybe. But home health, if there's a need, your home health nurse seeing you maybe one time a week, 2 times a week, the therapist one time a week, 2 times a week. So the home health is made to be an extension of care for that primary care physician. And so it is a good thing. It's more of like an extension of care for the services that are needed. So we work hand in hand with the doctor between those 6 month visits or even 3 month visits. And then that's where home health kind of works and coordinates with the doctor, medication refills, changes in things. And then the home health nurse will report back to the doctor and what they're seeing in the home because a lot of times seniors or anyone who's under home health, it's hard for them to go see the doctor. So
And then hospice care.
yeah, hospice is a scary word. Like I think I was joking around with when JT was like, you don't want to use hospice at like a birthday party. Like you don't want to just say like, oh, we're having fun, we're hanging out. Oh yeah, my mom's on hospice. You're like, like it's just not. It's not.
Yeah,
It's
that
hard.
brings the vibe
It
down
it
fast.
brings it down fast. But I think when you look at hospice, it's created by Medicare as a resource and a benefit for Medicare beneficiaries. And really and truly, when you're looking at birth and death, there's value. That's just always going to happen. Someone's going to be born and someone's going to pass away. And the healthcare system is meant to kind of wrap around the families during those two times, right? When you have someone who's pregnant and is about to give birth, you see everyone coming around them and helping them through that process. It's the same when it comes to hospice care and end of life. And that's where Medicare does justice and does a good job to help families through that process if it's done well. And so when someone says, they potentially need hospice, there's the Medicare deems that, 6 months or less to live. An order must be written by a doctor to say, I think you have 6 months or less to live based off of what I'm seeing. Nobody knows. Nobody's like in control of that. It's just the observation clinically of what they see. So the doctor will say, hey, um, go ahead and let's do an evaluation for hospice care. They'll write an order, send it over to the hospice company. The hospice will send a nurse out to evaluate based on the diagnoses and all the diseases that's going on with the patient. And then from there, say, okay, I think you do qualify for hospice. And so when you start hospice, it's basically like the hospice becomes your hospital at home. So you really don't go to the hospital anymore. Hospice comes to you. You don't go to all your doctors anymore. Hospice is your doctor because there's a doctor who oversees that hospice, and that's how they coordinate with all of the medications, DME, prescriptions, supplies, everything that's needed. It's the goal now is to keep mom, dad, uncle, aunt safe at home, comfortable, and now it's a huge support for the family. If they have questions, they have a nurse on call that they can talk to at any moment in time. They have and then literally that hospice team is there to guide them through all the way to the end. And it's you don't have to do it alone. It's good support. So,
For a family going through that process, um, you've described a relationship that sounds fairly intimate
mm,
and fairly frequent.
yeah.
Is that a process in which the nurse, well, first of all, is there one nurse who
Mm,
is the primary caregiver? And second, how intimate, how frequent is that relationship? Is this someone who is assigned to maybe one or two or three families only,
yeah.
and their involvement is intensive, or is it more periodic?
Yeah, I think it's more it's a tailored approach. I think that's the best way to say it is, when you have someone who's on hospice, you usually have a primary case manager nurse, but then that nurse usually has an on-call team that helps support the nurse so that the nurse isn't fatigued, right? So because that one nurse usually there's a National Hospice Association usually says one nurse should see anywhere between 11 to 12, 13 patients. That should be their caseload, right? And so when you have that, it can be emotionally fatigued. It can be, it's a lot for the nurse. So you have an on-call team that helps support the nurse after hours. And so usually families will have one nurse or two nurses. But when it's after hours, there is a team that kind of picks up that load for making sure they're supported. But they're given report, from that nurse to make sure that they're aware of what's happening with that loved one. And so when you have those together, that team is there to kind of wrap around that family. And then the frequency is, it could be one time a week, could be two times a week, it could be daily based off of how that loved one is progressing with their disease process. So, um, it's a beautiful tailored approach. That's kind of the best way we say it. Is you tailor towards the patient, the family, because some patients are like, no, we're good. We have my nephew's here down the street. He comes in and checks on mom, just come in like once a week. Or there's some that they have no help. And then, okay, yeah, we need to be there more than twice a week. We need to have our aide come out and help more. We need to have the nurse come out and help more because the family needs the support. So it's every family is not the same, and every family dynamic is not the same either, as well. So Yeah, that's a great question.
How do you think of your mission as an
Mm.
organization, particularly with regard to hospice?
Yeah, so we're faith based. So as a kid, my mom said that, but I kind of, as I got older, like understood what does it mean to honor God in what you do and in your work, and so as an organization, we try to do that to the best of our ability. And so when we honor God, that means when when no one's looking, we're taking care of people the best way we can, and so I think when it comes to mission in terms of healthcare, I mean, when you think about why healthcare was started, you have to think of the other person as better than yourself when you're a clinician. So healthcare is that. It is thinking of the other person before yourself. And so, when we are taking care of people, when we are even doing a podcast, like my heart is like, I hope that this is going to help someone to think about if they're thinking about going into the industry, it's about other people. It's about serving. That's what healthcare was meant to be. It's not like, no offense to McDonald's or no offense to Burger King, you can just serve food, right? But this is people that you're serving. And so I think when you're talking about mission, that's really what it's at. It's about thinking of the other person as better than yourself.
So when we were exchanging emails and we were chatting with Grace, I know we were talking about the topic of hospitality
Yeah,
and exceptional care.
yeah.
What does it mean in the context of your work and the work that your staff does to extend hospitality to the people you serve?
It's essential because it's like you're putting yourself in their shoes, right? If you were sick, how would you want someone to come to you in a hospital room or at home taking care of you if you were feeling terrible? You would hope that they would be genuine, that they would be kind, that they would be excellent in their craft and their skill set, and that they would be doing everything that they can to help you get better, or if there was no prognosis for you to get better, that you would pass away with dignity and respect and honor. And so when you're talking about hospitality, it's huge when it comes to home health or hospice care or healthcare because you're taking care of people in a vulnerable state and they're gonna lash out at you. They're gonna like yell at you. They're gonna be upset because they're dealing with their own emotions. But the hospitality is really about not taking offense to that too. Like we talk about like sometimes we're just punching bags. That's just what it is. You can't get offended. We're in an industry where you're going to feel that way because people are going through emotions. And so when you're talking about hospitality, it's about the intentionality of how do you take care of people and being intentional about tone, being intentional about how do you talk to someone, you know, um, just being respectful, of all different cultures, races, sexual background, whatever it may be. It's you're a human being. We're going to take good care of you, and that's good hospitality. So that's kind of what I see.
Hospitality is core to the way that we engage with one another, with our clients. It's a core aspect of our culture. I like the definition of hospitality being the difference between when something happens to you versus when something happens for you.
That's
It
good.
can happen to you, and that's not hospitality. If it's for you,
Mm,
that feels that you're being cared for. I would imagine that
yeah,
there has to be a lot of anxiety associated with
yeah,
hospice care in particular, or even home health care.
yeah,
I mean, this thing has happened that is outside of
yeah,
your control.
yeah.
I wonder how your team members, or maybe how in your own practice before becoming CEO, how you can think about how you can create a context in which it feels like something is happening for
Mm,
the person you're caring for.
I think it's realizing that everyone's human. We all have the same interests. We all have the same things that we enjoy. And that helps to foster that hospitality, right? So I'll give you an example. Like I like to I'll go to hospitals and meet with families who are potentially needing hospice care. I'll meet with them and meet with their loved one to meet with their family. And recently I met with a family member and end stage cancer, not looking good. We went through all the medications and with the social worker that was there and they reached out to our agency. And so I like to just go and meet with them sometimes, just to kind of see what's going on. And so I met with them and you could tell the husband's eyes were like foggy. Like they had been married for 50 plus years, deer in headlights. Like I have no idea what I'm about to walk into. And so we started talking, and instead of me going into like what is hospice, the jargon of like this is the benefits and stuff like that. I just started talking. I saw he had a shirt on, and I was like, "Oh, what school did you go to?" And he told me the school. I was like, "Oh, I went to that school. It's a Jesuit school." And he was like, "What? My son went to this Jesuit school." So we just started talking, and we started talking about football. We started talking about track, and um, he's a big Steelers fan, and so we just started going in on that. And you could tell he was just like, "Ah, this is great," and like, and then at that moment in time, he was like, "Okay, thanks. Let's talk about what I need to do for my wife." You know, and that's the humanity. I think that's what the hospitality is. It's not just going in there and just providing a service. No, like I love what you said. It's how do we? It's for that person, right? And so I think organizations in general, like you said, CEOs in general, it all starts with the leadership. How do you figure out a way to relate to people, and then from there provide the care.
You run a faith-based organization.
Mhm.
What does it mean that Charlin is faith-based? You talked a little bit about it. What does it mean in terms of the people you serve? I think there may be some misunderstanding about what
Yeah,
it means to run a faith-based
yeah,
organization.
it does. Yeah, so our it's all based on our core values. What do we believe, and what's our foundation? So our foundation is based off of Christian core values, but it doesn't mean that we are going to push a certain type of belief on families and on patients. It is to let them know that this is the core of who we are, and this is how we treat people. And we train all of our staff to believe, hey, you treat people well, you treat people with honor, integrity, excellence, human dignity, and trust, all those things, right? And so when we talk to families, we let them know that. And if they have, especially on hospice, there's a component of hospice that our job is to coordinate with them spiritually. So a lot of times, if they don't have a spiritual faith, that's okay. We just help them from more of a counseling session and helping them process grief and things. But then we have some families who are Catholic or Christian or Buddhist or Muslim or Sikh or all of these type of beliefs. We help coordinate them with their belief, and their community, and connect them to make sure that they are appropriately grieving and appropriately understanding how hospice, how end of life works. And so that's kind of, when families say, "Oh, you're faith-based," like, yeah, we are. It's more of like, we're here to serve you. We got to do what we got to do, but we're here to serve you from a
Mm.
background. So
So it's more about who you are, not about who they have to be.
yeah, yeah, 100%.
Shifting gears a little
Yeah,
bit, I was talking with the chief digital health officer for the University of Washington a couple
sweet.
of weeks ago. Yeah, and we were talking about lots of things, the evolution of healthcare, but in particular, the implications of AI
Oh yeah,
in healthcare and how it's being used today, how he envisions the experience of a patient will change in the future,
yeah.
the daily work of a physician might change in the future. How, if at all, is AI impacting your work, your business operationally?
The industry as a whole, and this is just Medicare as a whole, right? Medicare is a government funded industry. It is not cash based. It doesn't adjust all the time towards inflation. It doesn't do that. It's census driven, it's population driven, and if it's exhausted, it becomes exhausted. So with that said, each Medicare agency has to follow what Medicare's payers are, right? And how they pay them. And then they have to budget accordingly. And so sometimes they don't pay more based off of inflation. They just keep it the same. And so with that, you have to figure out, how do you continue to serve patients and families with no adjustments in inflation? How do you do that? So whether it's either volume or you cut costs. And what we've done is we figured out from an AI perspective, there's a lot of things that are tasks that can be done via AI that actually will save overhead costs. And so we've incorporated that from marketing to intake to post coordination with patient care, We use a system in our agency that we've built to kind of help, almost like an AI bot, to help send out things that I would probably have to hire someone to do. And we can't do that because of the way that funds are specifically for Medicare. So AI is huge when it comes to the home health and hospice realm. I see that as a huge benefit. I'm sure, for sure, like as you mentioned with the healthcare industry, it's only going to keep getting more, and a big help for so people can really focus on patients, and then the back end things can be done by AI if it needs to be done.
That's consistent with other conversations that I've had with folks in healthcare about how AI is and isn't impacting
Yeah.
their operations and their care. Can you give a couple of examples of the ways that you use AI today, and how you envision that is going to expand, and what does that look like?
Yeah, a good example is something simple as reminder tools for clinicians and their RN license, right? So built this system that shoots them an email and a text message automatically based on the date to say, "Hey, don't forget, you have your license that's going to be expiring in the next couple months. Please make sure to do this to XYZ." Those are just AI things that can be done, right? More clerical things. That's a good example. Even caring for the team. So we have happy birthday automated texts and happy birthday automated emails and messages, right? That, hey, happy birthday, it's your work anniversary. Like, we appreciate you. Or it's, how do you create that environment where it's, those are tasks that have to be done, but it's, you can intentionally do that to care for someone. And so utilizing that to care for our patients, to care for our team, and we've built that a lot. From a Medicare standpoint, there's a lot of tedious tasks that we have to do to remind on, HIPAA, OSHA, several different things that, we just automate those tasks, and it's done. And so uh, it's a huge help, and we're just getting started.
In your marketing, even in the educational information that you create and you publish, particularly video,
Yeah.
you often, my sense is, you're looking to remove the weight,
Hmm.
the stigma, the gravity
Yes.
that otherwise might be associated
Yes.
with home health care or
Yes.
hospice. You're trying to make it not maudlin.
Yes.
It's just, it's a reality, and it's okay to talk about it out loud.
We're trying to make it to where it's comfortable too, right? To talk about, and fun, right? Like, and normal. Um,
Right.
like, I
I
think,
was surprised that to look at your content and
yeah,
see that some of it's fun, some of it
yeah,
makes you laugh, which you wouldn't associate.
with hospice.
You'd have a preconceived notion that
Yeah,
hospice is going to be a very serious, kind of
yeah,
somber
yeah,
topic.
yeah,
There are no giggles involved.
yeah, yeah. I mean, I think
Good.
that's the thing, is like, it's life, right? Like, we all live in, like, I don't know, it was a couple of years, no, it was a year ago maybe. I think I saw something on that Shaq had a hip replacement. And I was like, yo, let's talk about that. Like, he had a hip replacement. What does it look like to have a hip replacement? That is a big deal, right? That's a normal part of life when you get old, especially being an athlete, right? Like, but it's like, we make that fun. We talked about the Mike Tyson and Paul fight. Like, Mike Tyson's 58 years old. We have patients who just did a hip replacement, and he was out there punching against. Like, we talk about those things and try to relate it to where, oh wow, like, okay, yeah, like, I can have a stint in a cabbage and still do what I need to do and go back to work in 2 weeks. Really, I didn't know that, right? That's life. And I think a lot of times the stigma of healthcare is like, ooh, don't talk about it. But like, everyone has a car. You have to change the oil. You have to change your tires. You have to talk about the car. So why don't we talk about our car, which is our body? And that's kind of that's the heart behind it. So
Yeah. Does that same ethos or sensibility, is it also a part of the care
yeah,
that your caregivers provide?
yeah, people won't listen to you until they feel like that you care about them, right? Until they know in their heart, okay, you care about me. I'm gonna listen to you, right? Like we kind of talked about before. It's like, how do you? A patient has to be able to understand before you walk in the door that this person has my best interest at heart. They know what they're talking about. They're actually skilled and professional. They have a good game plan on what my doctor's saying, right? And so before y'all you do that, you better have the best bedside manner. You better be friendly to them. you better help them understand that you're here, because if you don't, you could be the smartest nurse and the smartest doctor, best best SAT score back in the day. I don't even know what the ranges are now, but like, but it doesn't matter if you don't have that bedside manner.
I've been through hospice with family
Mm,
members, and I would imagine that there's a point at which, when you're sick, you
yeah,
just want to be treated like a person, not like a sick person.
yeah,
So I can envision that, being treated like you still have a sense of humor
yeah,
and you're still a
yeah,
three-dimensional person is
yeah,
probably reassuring.
yeah. We had a patient like a couple years ago, and she was a diehard Cowboys fan, and I had a buddy who worked at the Cowboys, and he was like, we're gonna get her tickets and everything." And she was so excited, but she passed away right before the game, and we were like, like, but we watched the game at our house, like it was cool, like, I think those are the things that is human being, like, man, she loved the Cowboys. Even at that time, I don't think they were doing that good, but she just loved the Cowboys. They're still not doing that good,
Sure.
actually. So
Right.
but
Yeah.
like, yeah, I think that's what it's all about, treating people with dignity.
I have to ask, I know you work with your wife and your mother.
Yeah.
What what are the challenges and the delights of doing that?
Oh, man, both my mom is a nurse and my wife is a nurse. So it is, I I don't know, I guess just being well, so let's talk about my wife. My wife is amazing, by the way. We went to school in St. Louis, and that's where we met. So I was in PT school, she was in nursing school, and we were dating, and so all we ever knew was studying together. We would study, like, some of the hardest classes in healthcare. We'd go to the library and just that's all we did. When we got married, we ended up working at the same hospital. So, like, she would be, night shift, and I would be the day shift on the same floor. So we just know how to work well with each other, and not everyone can work well with their spouses, but I think what I've learned is, for me, I can speak for myself. I've learned tone. When you're frustrated with work, it's not about, I let her know it's not her, it's work, and I'm frustrated. Can I just vent a little bit? And it's a safe space, right? So we have these things that we've created over the years, and it's just, we know, hey, I'm not frustrated with you. This is what happened at work. And then I got this from a mentor of mine a long time ago. Him and his wife were married for 60 years, and every month without fail, we always go to a staycation, or we go away to a hotel just like for one weekend. So the kids are watched by someone, or my mom, or a babysitter, and we just reset once a month. And so we've done that for 10 years, and so that's really helped us as well. With my mom's my mom. Like, this is, she started the business, and I've had to learn how to be humble, and the ideas that I have, I've had to help her honor what she's done, for these so many years, and take that history and add my own kind of like flavor to it, I guess, if you would say. But you have to honor those who've laid down the ground before you. You have to, and I learned that, and I'm constantly learning that. So a lot of it is just honor and respect. And when a new employee comes, if she walks through, I say, "Hey, this is my mom. She started the company, and I want you to meet her." And just, it's the honor factor. So yeah. I think it's not easy. I pray like every day. I'm not Aaron. I'm not kidding, man. It's not easy, but it is. It's legacy. Like I told you, it's legacy
Yeah.
years to come. That's why we do what we do. So, but
Yeah.
yeah, it's a great
Yeah.
question, man. That's a
I can
great
imagine
question.
it's challenging. I would imagine there are
Uh,
times when uh, it's less clear that you're the CEO and maybe more clear that you're the son.
100%. Yeah, it's totally humbling, but at the same time, it's like, it's the reason why I'm here is because I felt led. God led me to come and help my mom. So, and so that's why I'm here. So, but yeah,
That's great. So what's your vision
yeah.
for the organization?
Yeah.
Where do you want to be in 5 years or 10
Yeah.
years, or forget the time horizon? Where do you ultimately want the organization to be?
Yeah, I think, you know, like I said, this is year 21. I've been in the administrator for 8 years. I feel like I've probably been the administrator for 2 years because the 6 years is me learning everything and trying to figure out everything. And I think that just my vision for the company is a combination of what private equity can do and what I've seen it not do. I just want to be in Dallas. I just desire to be in Dallas, not expand outside of Dallas, but just saturate the market because when you're talking about care, there's only so much footprint that you can have in terms of the culture when you're talking about hospice, you're talking about home health. It's very hard to do that. And so I want to do it in a way that's just in Dallas. It's going to be they say next 10 years is going to be like New York in terms of the amount of people who are moving to Dallas. So we just take care of people here, provide good systems, good values, and that's it. My goal is that it becomes a place where people know years and years to come, even when I'm gone, that that's going to be a company where they know that Charlotte is a place where their mom and dad can be taken care of at any stage in life. And so that's my heart, that's my vision. Definitely gonna have to use some type of more investing, but the goal is that the primary ownership will be the family or the privately held company. So that way the vision of those margins and those things can be done healthily and not a whole takeover because I've seen the takeovers too many times and it's different. It's just very different. So that's my heart.
That's great.
Yeah.
Well, that's a laudable vision. Thank you.
Yeah, man, it's a good question, man.
Yeah, I've really enjoyed the conversation. I appreciate you
Yeah.
taking time.
Man, likewise, man.
Is there anything I haven't asked that we should talk about?
I think everything was covered. I think we broke down home health, we broke down hospice. The dynamics of like my mom and my wife is a huge thing because I think people don't understand how to run a family business because man, I I've learned a lot. I told JT and Tina, I was like, I'm definitely gonna write a book here soon because you have to do it the honoring of the patriarch, whoever started it is a big deal. If you don't, it's just not you can't go anywhere. But then you have to be able to understand what was the purpose behind why they started the company. And if it aligns with what you're doing, then do it. But like if it doesn't, there's some children that it doesn't align and they won't work with the business. There's no problem. There's not an issue. But it happened to align with me and I was like, "Oh yeah, we could scale this now in a different way." Because the mission and vision is still the same. So yeah, it's different.
Yeah, I can imagine it's pretty complex
Yeah, yeah,
and delicate at times.
yeah. Delicate is the word, Aaron.
Yeah.
That is like the battles between my mom and my wife over the last several years has been very interesting, but we've all come out like victorious. That's the best way to say it. So
Well, so having gone through that
yeah.
and hopefully been able to resolve those
Oh
conflicts,
yeah.
I can imagine that that creates kind of an efficiency, a shorthand in communication now, so that each new conflict is resolved more quickly,
100%.
resolved with less drama. Yeah.
100%, 100%. I've learned, even though I'm like, "Oh, wait, 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 I don't need to be offended on this area. This is just her saying this. Okay, cool. Alright," like, like, it's just like, it's like, "Oh, wait, 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 that's just more me internally. Okay, just disregard that." Okay. Like, it's more emotional intelligence when you're dealing with, 2 women that you love, love more than my mom 'cause it's my wife, right? But, like, at the same time, it's my mom, right? Like, so it's man, learning that dynamic of um, I is valuing all of their opinions, but also making a decision off of that. So
Yeah. Yeah.
it's a
There's this notion I like that I found helpful of what's called neutral thinking
yeah,
in
what's that?
any context, just remaining, not having necessarily an opinion as to what's good, what's bad, where things are headed right now. I'm going to remain neutral for as long as possible and consider the possibility that I'm totally wrong, I'm totally right, something in
Mm,
between. I'm still gathering information and I'm not getting my ego involved or
Yeah.
my emotions involved, which is super hard to do,
Yeah.
but it's a nice thing for me to kind of try to anchor to, particularly when I can feel, oh, I'm really offended
Yeah.
by that. To back off. Okay, I got to remain neutral here. And if I'm really offended,
Yeah.
I find that
Yeah.
there's actually a better than 50% chance that the person is saying something that has some
It's
validity.
true. I'm with you on that, man. Oh man, that's a very good statement.
Yeah.
It's there's part it, they've either hit something in my heart that I'm like, you know what? You're right, you know.
Yeah.
So that's
Yep.
really good. Yeah.
Yeah. Well, I really enjoyed talking with you. I appreciate it.
Likewise, man. Likewise. Thank you
Yeah.
for your time.